Good day. This is Dr. Nemi Santos, and let us now discuss the procedure on how to transfer a client from bed to chair, wheelchair, or a commode. At the end of the lecture demonstration, the students will be able to transfer a patient from bed to chair, wheelchair, or commode with maximum comfort and safety for both the patient and the nurse. Specifically, at the end of the course study, the students will be able to recognize hazards in a particular situation, provide safe setting for transfer, give examples of how different diagnoses and capabilities would affect plans for transfer, gather data on patients' abilities and diagnosis before moving a patient, and successfully transfer a patient from bed to chair, wheelchair, or a commode. A commode is a movable toilet that does not use running water. It looks like a chair with a toilet seat and has a bucket of container underneath. The container can be removed for cleaning after the commode is used. A commode can be placed beside the bed if a person cannot get to the bathroom. What are the purposes of transferring a patient from bed to chair? Movement maintains and restores muscle tone, stimulates the respiratory systems, and improves elimination. Improve the physical and psychological well-being of patients. Before transferring a client, assess the following. The client's body size. Always remember, it is easiest to transfer a client if the weight of the healthcare provider is appropriate for the client. However, in some instances, that if the client is overweight or obese, assistance is further needed. Ability to follow instructions. Always check the client's consciousness before the procedure. Observe patient for activity intolerance, muscle strength, joint mobility, presence of paralysis, and always observe client for any discomfort. Observe for presence of orthostatic hypotension. Orthostatic hypotension is the sudden drop of blood pressure upon change of position. Patients may experience dizziness or loss of balance. Also assess the technique with which the client is familiar, the space in which the transfer will need to be maneuvered, the number of assistants needed to accomplish the transfer safely, and the skill and the strength of the nurse. First, gather all the equipments needed in transferring a patient from bed to chair. Robe or appropriate clothing. Slippers or shoes with non-skid soles. Transfer or walking belt. Chair, commode, wheelchair, or stretcher as appropriate to client need. What are the steps in transferring a patient from bed to chair? First, you have to do the preparation. Always verify patient's name and introduce yourself to the patient. Inform patient of the procedure and its importance. Assess the health condition of the patient and other precautionary measures to perform the procedure. Assemble all the articles and equipment needed and bring to the bedside. Perform hand hygiene. Provide for patient privacy. And put patient in an appropriate position. Now we are ready to transfer a patient from bed to chair. Hello everyone. Today we're going to demonstrate transferring from bed to chair, wheelchair, or commode. At the end of the demonstration, the students are expected to transfer a patient from bed to chair, wheelchair, or a commode with maximum comfort and safety for both the patient and the nurse. Good morning, sir. I'm your nurse for today. I'm Nurse Nemi Santos, and you are patient Luis. How are you feeling right now, sir?
I'm fine.
So you are fine, that's good. I am now going to transfer you from bed to chair so that you'll be able to sit. Are you ready?
Okay.
So I will now strip off the linen for you to be able to have an easy transfer. Are you ready now, sir?
Okay.
Position equipment appropriately. Lower bed to its lowest position. Lock wheels of the bed. Place wheelchair parallel to the bed, as close to the bed as possible. Put the chair or side of the bed that allows client to move toward their stronger side. Lock wheels of the chair or the wheelchair and raise foot plate. Prepare and assess the client. Assist client to a sitting position on the side of the bed.
Sir, I'll assist you to sit at the side of the bed.
Assess client for orthostatic hypotension before moving the client.
Sir, are you feeling dizzy? Okay, very good.
Assist client in putting on bathrobe and non-skid slippers or shoes.
Sir, I will put robe on you.
Place a transfer belt snugly around client's waist.
Are you feeling alright?
Yes.
Give explicit instructions to the client. Ask client to do the following.
Sir, you follow me? My instruction.
Yes.
Move forward and sit on the edge of bed with feet placed on the floor.
Can you please move a little forward? Okay, at the side of the bed. Okay.
Lean forward slightly from hips. Place foot off stronger leg beneath edge of the bed and other foot forward.
Okay, sir, you put your legs here and then the other foot forward. Okay?
Place their hands on the bed surface so client can push while standing.
Sir, you put your hands here so that when you stand, it will give you support.
Position self correctly. Stand directly in front of client and to the side requires the most support. Hold the gait belt with the nearest and the other hand supported the back of client's shoulder. Lean trunk forward from hips. Flex hips, knees, and ankles. Assume broad stance, placing on foot forward and one back. Mirror placement of client's feet if possible. Assist client to stand.
Okay, sir, we're going to stand. Hold my hands here. Here. Ready? 1, 2, 3.
Sit
Okay.
toward the wheelchair or chair.
Sir, you hold your hand here. Okay. You feeling alright? Okay. After the procedure, it is important to do the aftercare. Dispose contaminated articles according to sanitation code. Clean the used articles and return it to proper location. Perform hand washing. And lastly, document the procedure performed and the client's response. You have now transferred your client from bed to chair. This procedure is also applicable if you're going to use a wheelchair or a commode. Now, if you're going back your client from chair to the bed, then reverse the order of the procedure.